So let's start with the integumentary system, the skin. It's the largest organ in the body and it protects our muscles and bones. It's also our first line of defense against microorganisms. Also, it can help us regulate temperature with things like perspiration and prevent moisture loss. It also senses pain, pressure, and temperature to let us know if something's wrong. So when that skin barrier breaks down, we're worried about a top concern for our hospitalized clients, and that is pressure injuries. So this is a nursing sensitive indicator, so good nursing care can prevent them. A pressure injury is an injury from prolonged pressure, friction, and or shear. So prolonged pressure happens on these bony prominences like the sacrum and heels, and that causes that bone to put pressure on the skin, decrease perfusion, and lead to injury. Then we see friction. That's from rubbing against a surface like a bed or a wheelchair, and that causes superficial skin damage. Then we see shear. That's from something like sliding down a bed, where the bottom tissues are going in one direction and the top layer of tissues are going another, and that causes tissue damage. The NCLEX loves to test who's at highest risk for a pressure injury, so pay attention to these first 3 star points. Those with increased moisture exposure are those incontinent clients. They are at high risk because their skin gets soft from moisture exposure, leading to injury. Then our decreased mobility clients, like those with stroke or post-operative clients, they are not moving as much, so they can have prolonged pressure over these bony prominences like the sacrum. Then those with decreased sensory perception, like those with neuropathy or paralysis, remember they can't sense pain or pressure, so they're definitely at risk for an injury. Then we have those with decreased nutrition or perfusion, like our diabetic clients. They have decreased perfusion, so there's not as much nutrients getting to that skin, and it can cause that skin to get fragile and weak.